All right, it's about 12 p.m., so we will begin. Welcome to today's webinar, Climate Change and Tick-borne Diseases, a One Health Approach in Alberta, British Columbia, and Saskatchewan. This webinar is brought to you by the Canadian Public Health Association through the Infectious Disease and Climate Change Project. My name is Maddie Schuler, Project Officer with CPHA, and I'll be the moderator for today's webinar. Before we begin, we want to acknowledge that the Canadian Public Health Association's office is situated on the ancestral and unceded territory of the Algonquin Anishinaabe people. They have been the guardians of this land for a millennia, and we are grateful for the example their stewardship provides. CPHA is committed to working with all First Nations, Inuit, and Métis peoples and their governments in realizing meaningful truth and reconciliation. I wanted to take a quick minute to show you all the winning posters from CPHA's Infectious Disease and Climate Change Grade 6 poster contest. This was an opportunity for teachers and students to learn more about climate change and the impact it is having on the spread of infectious disease like Lyme disease and West Nile virus in our communities. So students across Canada could submit a hand-drawn poster to bring attention to a climate-sensitive infectious disease for a chance to win a Chromebook and other great prizes. And you can actually see all 8 winning posters at cpha.ca/contest. And we are looking to run this contest again in early 2023, so stay tuned. A few quick notes before we begin. If you have any questions for our presenters today or technical difficulties, please type them into the Q&A box at the bottom of your screen. After the presentation, I will read out the questions and our presenters will answer them. We strongly encourage attendee participation and look forward to hearing your thoughts and questions today. Secondly, our webinar is being recorded and will be made available on CPHA's YouTube channel a few days after the end of this presentation, and presentation slides will also be shared. Lastly, we would love to get your feedback. So after the webinar, please fill out our 5-minute survey, which will open automatically in your browser once you close Zoom. Now, I would like to introduce our speakers for today's webinar. Dr. Erin Fraser is a public health veterinarian at the BC Centre for Disease Control. She is a graduate of the University of Guelph and has over 20 years of experience as an epidemiologist, public health veterinarian, researcher, and executive director. She has 10 years of leadership experience co-founding and managing Veterinarians Without Borders Canada. Erin has worked across Canada and internationally with interdisciplinary, multicultural teams to develop programs and projects that address public and animal health issues, from zoonotic disease surveillance, prevention, detection, and control, to wildlife health, food security, and factors that affect livelihoods. Her current work at the BCCDC includes surveillance of zoonotic diseases and foodborne pathogens, antimicrobial resistance in companion animals, and climate change and tick-borne diseases. Dr. Susan Cork joined the University of Calgary Faculty of Veterinary Medicine in 2008 as founding head of the Department of Ecosystem and Public Health. Prior to joining the faculty, Susan spent 5 years with the New Zealand Ministry of Agriculture, where she held a number of policy and management positions. She completed her veterinary degree at Massey University in 1987 and returned to complete a PhD in 1994. During her PhD, she provided diagnostic support for wildlife organizations in partnership with the New Zealand Department of Conservation. In 1995, she accepted the position of Veterinary Diagnostic Laboratory Manager in the Himalayan Kingdom of Bhutan, and this was part of a European Union-funded project to strengthen veterinary services in Asia. Her research interests include global health, infectious disease, and veterinary public health. Dr. Andrew Cameron is an associate professor in the Department of Biology at the University of Regina and co-director of the Institute for Microbial Systems and Society. Andrew is a microbial geneticist specializing in the development of new DNA sequencing and genomic analysis tools to detect pathogens in the environment, animals, and people. The Cameron Lab conducts genome analysis to discover new potential pathogens and pathogen diversity in projects across North America and Africa. Another focus of the lab is to understand how the ranges of environmental and zoonotic pathogens are expanding or contracting due to climate change. The Cameron Lab is working as part of the TCC-3W team to improve the molecular detection of zoonotic pathogens, to sequence pathogen genomes, and to understand pathogen diversity. And last but certainly not least, Stefan Iwasawa is the project coordinator for the TCC-3W project at the BCCDC. Along with his many years' experience as a project manager, he has extensive field sampling experience in the collection of ticks, recreational, and irrigation water. He has worked in the field of veterinary epidemiology since 2008. And with that, I will turn it over to our presenters.
Wonderful. So I'm going to kick us off here. Thanks so much for the introduction and for the opportunity to present today. Stefan, if you could move to the next slide, please. I'd also like to take a moment to acknowledge that I live and work on the traditional unceded territory of the Lekwungen people, specifically the Songhees and Esquimalt First Nations. I love to show this photo of the Garry Oak Meadow. I live on southern Vancouver Island, and we are very fortunate to live among these amazing Garry Oak ecosystems. And for millennia, the Lekwungen peoples harvested and cultivated the camas bulbs, these purple flowers that are shown in this photo. So the wildness and the longevity of the people here that we continue to, I continue to feel very grateful to live and work here. So next slide. So before this project, it was identified that there was really an urgent need to develop up-to-date predictive maps to guide risk-based surveillance efforts for tick-borne diseases. We also recognized that there was research that was needed to explore how transmission dynamics for vector-borne diseases in our 3 participating provinces might play out under future climate scenarios. We recognized that climate change was predicted to cause and is causing a number of significant impacts on these 3 Western provinces, with large proportions of Alberta and Saskatchewan expected and experiencing higher temperatures, lower levels of participation and leading to droughts, and in BC with higher levels of precipitation. So despite some preliminary modeling that had been done in Western Canada, there was really insufficient data collected to create robust risk maps. And much of the modeling that had been done before this project had explored the potential for the black-legged tick that's found in Eastern Canada, Ixodes scapularis, moving to the north and to the west, but very little work that had been done with regard to mapping the potential for the Western black-legged tick, or Ixodes pacificus, to move to the north and east. So as a result, the origins of this project started with these series of questions that were shared amongst our team members across Alberta, BC, and Saskatchewan. So really trying to understand tick distribution trends, understanding prevalence and distribution of tick-borne diseases in both humans and animals, understanding the potential for introduction of new ticks and tick-borne diseases, thinking here in particular of the Asian longhorn tick that we're starting to see more and more of in the eastern US. And then also understanding climate predictions and how they might impact on tick-borne diseases in our respective provinces. And understanding if there are specific hotspots that we need to be aware of to be able to develop knowledge translation and engage communities in surveillance efforts. What evidence do policymakers need? What do they need to know? And what capacity needs to be put into play? So these are kind of the drivers for how we shape this project. Next slide, please. So we together, this project, there's 3 main goals. The first one being enhancing surveillance of tick-borne diseases. And the 3 objectives under this goal are really to improve detection, monitoring, and surveillance of ticks. So looking at laboratory methods, are there ways that we can detect other tick-borne pathogens? An example of this is we've supported the BCCDC to develop a multiplex tick test or tick-borne pathogen test, and then some of the work that we're doing with Dr. Cameron, which he will get into in a few minutes. And then another objective is around increasing access to an analysis of human and animal case data from multiple sources. So again, looking at those beyond borreliosis, but also looking at anaplasma, babesia, ehrlichia, and other tick-borne pathogens of interest. And then again, that third objective around improving availability of tick-borne pathogen genome sequencing. Next slide, please. So the second objective is really around enhancing prediction and response capacity for tick-borne diseases in our participating provinces. The objectives under this goal are really in looking at modeling under climate scenarios for black-legged ticks, and looking at the habitat suitability for Asian longhorn tick establishment in the Western provinces. and across Canada, and looking at other ticks and wildlife winter ticks and so on. And then how do we also look at other methods for enhancing surveillance as well. Another objective is really improving the availability and access to the evidence base and developing risk maps, habitat suitability maps, increasing knowledge translation resources that are available to a wide range of stakeholders. And our third goal, next slide please, Stefan, is really around that enhancing capacity. So a lot of the work that Stefan and I do is really how do we promote networking, information exchange, policy dialogues? How do we support One Health training between all of our team members, but beyond to other stakeholders that are interested in this issue? Next slide, please. And so to address these wide-ranging objectives really is essential to work collaboratively across disciplines and sectors to understand and work towards addressing the complexity of tick-borne diseases in the context of climate change. And as a result, the One Health approach is the guiding framework for our work. I think now more than ever, we are all recognizing that the health of humans, animals, and ecosystems are very intricately linked. And learning to work, across disciplines, sectors to communicate and coordinate, build capacity is so essential. This representation here is of a One Health approach, and it was developed by a new One Health high-level expert panel that was recently formed by a partnership between the World Health Organization, the UN Environment Programme, the World Organization for Animal Health, and the UN's Food and Agriculture Organization. Next slide, please. I think this will come up several times throughout our presentation, but I just really wanted to highlight, first of all, the generous support from the Public Health Agency of Canada, the Infectious Disease and Climate Change Fund to support this work, and just the wide range of collaborators that we have the great pleasure of working with. And without further ado, I am going to turn it over to our next presenter, Susan. Sorry, I couldn't remember if it was Andrew or Susan. Thank you.
Thanks, Erin. So I'm just going to share a little bit of the work we've done within the modelling team. So this is work done by quite a large group of us, but these slides have been put together by my colleague, Dr. Isabel Colonia, who I think will be with us amongst the broader audience here, and Carl Dizon, who was one of our summer students this year. And we have a number of other people that we'll acknowledge at the end, but experts from across Canada, including people like Patrick Layton, who's one of our colleagues in the East, who had some really good comments and some good directions that they've given the team in this piece of work. We've also done some work on the Asian longhorn tick, which we presented previously. And if anybody's interested in that work, I can send them the publication that came out just about 18 months ago. Next slide, please. So the broad aims for the modelling group really were just to improve the availability of some of the risk maps that have been developed over the years and to update them and modify them based on the current data that's coming in through a number of sources, which I'll elaborate on a little bit later. And also to try and help fine-tune some of the assumptions that have been made in the past, because as Erin indicated, the behaviour of the Western black-legged tick, Ixodes pacificus, does seem somewhat different to Ixodes scapularis in the East. And so some of the assumptions and predictions about how it might behave, we've found are probably not quite true. And so we need more information to validate some of the new predictions and models. Next slide, please. So we did have a summer student, as I mentioned earlier on, funded by Public Health Agency of Canada and Alberta Innovate. So we thank the various sources of funding there. But he did quite a comprehensive literature review on modelling of ticks across the Western Pacific regions of the United States and then up into Canada. And interestingly enough, most of the work that he found published, particularly on the modelling side, was actually generated from California. Some really interesting publications, very high quality work, but we're wondering with some of the predictions we're starting to see, some of the data we've found, whether or not perhaps we're a bit different from California because we've got a very different climate and landscape. Next slide, please. So obviously you can't do modelling without good representative data. So when we were looking at the data from BC, largely generated from the British Columbia CDC, we realised that actually there was a lot of really relevant data coming out of Washington, that if we were going to do some modelling, that we should include that as well, because after all, ticks and the diseases they transmit don't really recognise the border. So we were very fortunate to be introduced to Dr. Liz Dijkstra, who shared some of her field collected data, and also we accessed some of the Clydron field collection data as well, some historic data. For the climate data, we used Climate North America, looking at seasonal bioclimatic variables, and also the North American Environmental Atlas Level 3 terrestrial ecoregions. That takes into account some of the changes in vegetation in different parts of Canada and the US, and does allow some comparisons from one region to another. We looked at future scenarios with guidance from climate change experts, and we used a middle of the road assumption based on some of the latest predictions, looking at carbon emissions, which are actually probably about what's status quo right now. Next slide, please. So the data sets we looked at, we do have passive surveillance data, which we'll talk about in a moment, but we thought for our modelling, we should use the active surveillance data. So from British Columbia, that was largely based on samples collected from rodent trapping, which those ticks had also been tested for Borrelia. And in Washington, a lot of the data was collected from active flagging, and we have some key presence points noted there on the map in red. Next slide, please. So we looked at various best fit models. In the end, after using various different approaches, we decided that actually the MaxEnt approach, maximum entropy, was best for the kind of data that we have, because it's a good tool to use when you've got presence only data. Surveillance, as you probably realize, is quite an expensive program, really. And if you've got a large area to cover, which if we're covering the whole of British Columbia and Washington, that is rather a large area. And so presence only data is really what we're limited with at this point in time. And we found a number of variables were kind of key to some of our predictions. So that includes frost-free days, it includes minimum temperatures in the fall, it also includes climate moisture index and moisture deficit. Next slide, please. So we're looking at current habitat suitability based on the presence points that we have. You see in dark red and red, those are the areas where we think we're likely to find the ticks, and actually the passive collection data actually supports those predictions. And then if we look to the next slide, if we look at some of the changes that might happen in the future, and this is very preliminary work, we're going to do more work to try and validate this based on some of the more recent data, but you can see a little bit of a northward and inward spread of where tick habitat might be suitable. Doesn't necessarily mean to say ticks will end up thriving there, because obviously there's other factors to be taken into consideration. Nevertheless, we can see a movement to the north and to the east. Next slide, please. Now, if we look at Lyme disease and hotspots, BCCDC has got a number of maps, I think, already on their website. So what we're showing here is pretty much what's been found in the past, but we are also seeing some new hotspots that are developing. And in the purple areas there, we're trying to blank out a little bit some of the urban areas, because what we see when you actually put the passive data onto these maps, you're going to get hotspots that are predicted by population size, just because more people are going to be submitting ticks from their areas. There's not always a travel history on some of the passive data. And so this is why these maps, the preliminary maps, are actually generated from active surveillance data. Next slide, please. So this is actually the passive data here. You can see some of the hotspots, not surprisingly, around Vancouver and some on Vancouver Island there, and derived from a number of different species, but there aren't really enough samples to actually generate genuine risk maps at this moment in time, but that's probably the next step that we'll move on to as we get more data in the future. Next slide, please. Anybody that wants to get involved, I think most of you will have heard of ETIC, which is something that we're working with the ETIC program to look at new data that's coming in. There's still a few areas that are underrepresented, probably largely because people either don't know about the program or it's an isolated area where people haven't really been coming across so many ticks because they're large areas. And so probably more active surveillance needs to happen in those areas if funding became available. And then for those in the US and other parts of the world, iNaturalist also is a very good source of data that we've been looking at for our work on Dermacentra albopictus, for instance, and the ghost moose work. Next slide, please. So here we are. I'd like to again thank Isabel Colonia, and I think if you've got any modelling questions, she's our spatiotemporal modeller, an engineering background, so we really do have a One Health team here, but she put together a lot of those maps and we're very grateful for her input there. Sunny Mac from the BCCDC, Elizabeth Dickstrove mentioned, and then Trevor Murdoch and Colin Mahoney both gave us some guidance on choosing our climate change projection. Thank you for your time.
And now my turn, and I've asked to be able to share my slides. And as the geneticist, I get to show, I think, a lot of data. And so today I've endeavored to test some new animations I've never tried before. So you might hear some oohs and some ahs as I surprise myself with how I walk through this data. And first, I would like to acknowledge that today I'm at the University of Regina. So I'm working on the territories of the Cree, the Saulteaux, the Dakota, the Lakota, and the Nakota peoples, and the homeland of the Métis Nation. And the University of Regina is located on Treaty 4 lands and has a presence in Treaty 6. Much of the work I will present today is what I've been doing where I'm normally located in the unceded territory of the Coast Salish peoples, and specifically the homeland of the Snuneymuxw Nation. So my contribution to this consortium was to really develop the genomic side. And we benefit really from, well, living through a pandemic at the moment that is accelerating genomic applications in public health. And this is something my lab's been working on for quite a long time. So I'm not a tick and tick-borne disease specialist. I tend to see the world a little bit more from the DNA up and from the microbes perspective. And so I'll walk you through today what we've been learning from sequencing the genomes of various Borrelia burgdorferi isolates. And then I'll touch very, very briefly on what was one of the main goals, was to develop a new technology for genome sequencing of tick-borne pathogens. We are progressing on that. I'm not going to talk about it today, but needless to say that one of the first steps we need to develop these improved technologies is more genomic information about what has and what is currently circulating. So one exciting aspect about this project is that when I got involved, we did not have any Borrelia burgdorferi genome sequences available for Western Canada, so nothing from British Columbia. And it's also an exciting pathogen to work on because its genome is rather a puzzle. It's unusual in its complexity and its architecture, and it has a large pangenome. So there's a lot of genetic variability between different individuals in the species, and we certainly do see signatures of recombination where genes and alleles are moving between different bacterial isolates. And so you can see the credits there of the various scientists, both in the Institute of Microbial Systems and Society here at the University of Regina, and then at the Center for Disease Control, or BC Center for Disease Control, where those collaborators are those who sequenced the DNA. My group's been involved in this project on the analysis side. So what we had was 51 bacterial isolates that were collected by this BCCDC between 1993 and 2016. And on the right-hand side there, you can see essentially the locations where these different isolates came from, which was illustrated on the previous slide. And shotgun sequencing by Illumina technology was conducted on these different bacterial isolates. And then our role was to assemble these genomes and to be able to, well, reconstruct their phylogeny and look at the relationship between the different bacterial isolates and their geographic and temporal distribution. And for the next few slides, I'm going to show you this type of illustration, which is the phylogeny that we're able to reconstruct once we sequence the genomes of these bacteria. And here I'm just showing you a piece of the phylogeny. I will zoom out and show more shortly. And when we build a phylogeny like this, what we can do is add the additional pieces of insight that we know about these Borrelia isolates. So for example, where did they come from in BC and Alberta? What was their tick host and what was their animal host? Tick host is not known in all cases. Not all of these were isolated from ticks. So the first thing we discovered was, in fact, that there was 3 Borrelia species contained within these genomes, and the vast majority of them were Borrelia burgdorferi, and that's where I'll focus the remainder of my presentation. So to build this phylogeny, we adopted what is really the traditional typing technique to identify how different Borrelia isolates are related on a genetic level. So meaning that from sequencing their whole genomes, we could extract the sequences of the genes that are standardly sequenced to understand the different sequence types of the different isolates of bacteria. And on the right-hand side there, what you see are those colored dots represent the gene. And so each colored dot is a different gene. And then if it's filled, then it matches a known sequence type. And if it's empty, the gene is there, but it's a new sequence type that we're just observing for the first time in this data set. And so you can see I've just taken the top of the phylogeny here, and already there's, you can see a lot of genetic novelty among these BC isolates, or almost all British Columbia isolates here. The Borrelia americana does not have a well-established sequence typing system, so we can see that those are all novel for us. And additionally, another gene that we'd like to zero in on is the OSP-C gene, which is involved in the virulence potential of Borrelia. So to zoom out now, look at the full phylogeny, you can see that the majority of genomes that were sequenced were Borrelia burgdorferi, isolated from many different hosts, different animals, and the environment when known, primarily from Ixodes pacificus. And again, on the right-hand side here with the stars, you can see the amount of genetic novelty that we're discovering in these genomes. And so for these ones that are new sequence types or closely related to sequence types that we already know, we name them accordingly. And I'm going to show that on the next slide as well. So, well, what about the temporal aspect? And starting back in 1993, here you can see the isolates from 1993 mapped according to, well, the date of their isolation and the sequence type with which they match, or in this case, it's hard to see, this needs to be redrawn, but there is an open circle here that indicates that there is an isolate that is related to this sequence type, but is not identical to this sequence type. And then as we advance through time, we see, well, I won't say patterns per se, but interesting observations about the diversity of the genomes being isolated largely from a fairly small geographical area. Most of these are from the Lower Mainland in British Columbia and Vancouver Island and Southern Gulf Islands. We can see that some genotypes are present in the early 90s and then detected again in this case 2010. So there's numerous cases of that. That's shown by gray, that continuation of where we're redetecting those same genotypes in British Columbia. We also see some travel associated types here in green. So these were isolated in BC, but had a travel history of coming from the United States. And we can see that, yes, they are novel sequence types that don't match anything else that we had otherwise detected in British Columbia. One aspect we see is that in a few cases, we can see some genotypes that are unique to either the Lower Mainland or to Vancouver Island, but with the low amount of sampling, we can't say with any certainty that they are truly unique to those geographical locations. Instead, the pattern that's more emergent, I think, is that there's a fair amount of mixing. It is a complex population structure. So back to this overall phylogeny, to wrap up, I want to do another analysis that we were able to conduct. And for that, I'm going to zero in on one of the subgroups here. And we've been able to, excuse me, define the Borrelia burgdorferi, or subclassify them into 4 different subclasses based on their phylogeny. And we find all 4 of those subclasses in British Columbia, and I'll show you that on the next slide. Here I've just pulled out subclass C as an example, and further to what I said on the last slide, we see a case where there's an isolate from the island that's very, very closely related to an isolate from the mainland. So a complex population structure of potentially, I'm not sure what that movement would be. I'm interested to talk more with folks about how we see this distribution of these isolates. Now I'm going to redraw this phylogeny into a circular format. There it is. And so this is the same clade. And now what we've done is we've considered whole genome sequences of Borrelia burgdorferi that were generated by the National Microbiology Lab in Winnipeg and published in 2018. So these were genomes coming from Eastern Manitoba, Western Ontario, and Nova Scotia. And in the sort of greenish teal are primarily British Columbia isolates. And then in the purple are those from more eastern parts of Canada. And what we can see within this subclade C is, again, a very complex population structure where we actually have very close relatives popping up both in Eastern Canada and Western Canada. And this was a bit of a surprise because this hadn't been noted in the literature before, this level of population complexity. We also observe a few interesting features just in this subclade here. On the right-hand side, you can see these OSP-C. So this is the virulence determinant gene and the different types. And we can see that within this clade, there are 2 different types represented. And then this is a British Columbia isolate where it has the gene, but it is very, very different from all other Borrelias that we've sequenced, well, really across North America, where sequences are available. So this is a new OSP-C type. It is so different from other Borrelias. It's as different as OSP-C sequences from other species of Borrelia, if not even more divergent. So this represents to us where these isolates are fairly closely related. There's been a recombination event where that virulence determinant has been swapped genetically, probably acquired by this S36 isolate. And then finally, I can, with my final animation, let's see how this one works, put this subclade into the larger context of all 51 isolates, this would be the 47 or so Borrelia burgdorferi, and about the equal number sequenced by the National Microbiology Lab. So again, the sequences we're working with from British Columbia in that greenish color and the purplish color for the Eastern Canadian. And we see this same population structure in these other subclades as well, where there's both Eastern and Western Borrelia isolates represented. So a very mixed population structure. We do notice a few events of recombination of OSP-C alleles. And so our next step now, and what we're conducting right now, is to conduct long-read DNA sequencing of some of these isolates to better understand the plasmids, which are these accessory genetic elements that carry some of the virulence determinants, like the OSP-C that I've mentioned here, and doing an improved mapping and analysis of the pan genome. So these are the genes that appear perhaps infrequently or are particularly divergent between different isolates. And with that, I'm going to wrap up. Thank you very much. If I can find this option.
Wonderful. Thanks so much, Andrew. So I'll round off the group here this morning, everyone. I'm just going to touch base on some of the knowledge translation and also some of the outreach that we've done, along with some of the surveillance activities that we've been doing here at the TCC-3W. So just in terms of knowledge translation, we've launched the website. We've come up with our first infographic, which is on the right here. It's a kind of a 5-year average of ticks submitted in Western Canada. It gives you a good outline of the different species that are mainly submitted. Of course, if you look at the map here on the top, you can see a lot of dermacenter species being submitted in Alberta, Saskatchewan, and British Columbia. And then just down here on the bottom left, that's where you get your Ixodes pacificus mainly taking place. is kind of an established population. We do have Ixodes scapularis up here, and of course there's no confirmed established populations in Western Canada at present, although there are some interesting findings. A lot of them are attributed to bird migrations and also travel history when you do get them popping up here and there. Looking at what the labs are getting in terms of submissions, you can see kind of our donuts down here. Of course, British Columbia rounding it out with the highest amount of Ixodes pacificus being submitted. And you get the odd, mostly travel related in Alberta at around 30. And then if you look at Ixodes scapularis, those are also found due to, like I said, travel and bird migrations in Alberta, I think around 153 there, if I can read that clearly, and around 9 in Saskatchewan. Now, if we look at testing, though, if you see how many ticks on average over a 5-year period are tested, in British Columbia, you're looking at around 900, and of those 900, only around 2 are generally positive for Borrelia. In Alberta, a little bit higher, and of course, these are averages over 5 years, around 30 out of every about 160 there. And then finally, in Saskatchewan, only around 9 Ixodes scapularis submitted to the lab there on average, and around 1 of those, around 10% being positive when it comes down to it. Well, we're really promoting ETIC, as Susan mentioned before. I'll talk a little bit about that in a second here. And we've also taken part in the CLIDRN, which is the Canadian Lyme Disease Research Network. It's been going on in British Columbia since 2020. We started off with 5 sites. The following year, we increased that to 10. And then just this year, we wrapped up sampling on 20 sites, 10 on Vancouver Island, 5 in the Vancouver area, and then 4 in the Okanagan region. And that's part of a wider group that's going across Canada. And that's with our partners, Patrick Layton at Queen's University. This year, I think there's 200 sites that are done across Canada. And it's really based on sentinel surveillance, repeating sampling at the exact same sites in order to see kind of a baseline and also get an idea of what's going on and what's changing. In terms of publications, we've got 5 publications so far for the project, with a few more in the works. We've had around 25 media interviews, and we've done around 22 now presentations. In terms of mentorships, we've had 4 undergraduate students work with the project, along with 1 research associate. And there's a lot on the table, or a lot to come still down the pipe. We really want to do a couple of ticks and climate change infographics. The Asian longhorn tick, I know that's a really hot topic down in the East right now in the States, and something that we'd like to get the word out a little bit more. And then finally, do you know your ticks? Having gone out in the field a lot, especially this summer, a lot of people are, at least on Vancouver Island, unfamiliar with how small ticks are and what a tick looks like. I've been called a couple of times by friends saying, "Hey, is this a tick?" And maybe it's an ant or a stink bug or something along those lines. So there's still a little bit of knowledge translation that can occur there. So ETIC, what is it? It's as it says here, fast, easy, and fun. etic.ca is where you'd go to check it out. And what is it exactly? Well, I guess the technical term is a public platform for image-based identification and population monitoring of ticks in Canada. It is available across Canada. BC signed up in, I believe it was 2021, and it is into the territories. And according to the website, it takes 3 minutes. It depends on how clumsy your thumbsies are. For me, it always takes a little bit longer for whatever reason. And if we just look at the numbers actually off the website, 10,000 submissions, over 10,000 submissions so far in 2022, I think a little bit higher now. And moving on to our next slide. How does it work? How does it take part? Or how do you take part? It's really quite quick and easy. You create an account. You make sure that what you're looking at is a tick. You take a couple of quick shots, and then you submit that information and you bag it for later. So if you can download the app. It's free on Google and in the App Store. This is kind of some screenshots that I took. You can see there that it took me a little bit longer based on time to do this. But when you open the app, it's really quick and simple. The first thing you see is submit. So you can hit that. You let them know which province you are from is the next question. And next, you upload a couple of pictures. They're looking for specific pictures. They're hoping that you have maybe a white background so you can see the tick a little bit closer. You're around 7 to 15 centimeters away from that tick. If you can, and I'll just jump to our next slide, you steal your daughter's ruler out of her school bag and you stick it down beside that tick so you know roughly how big they are. And those are millimeters right there. So you can see that's 1 millimeter. That's a nymph, so that's a teenager of the tick world. world. And those are the ones that are most likely, if they are going to be carrying Lyme disease, to transmit it, just because they are so small and they've already taken a blood meal, so they've picked up Borrelia to begin with. So once you uploaded those pictures, it's going to ask you, where do you think the tick came from? If you click on this, it actually brings up a map, so you can actually drop a pin, and if you're like me, you're out flagging. I know everyone does this on a Saturday afternoon, so you can say specifically where you are, or give them a rough idea of which park you are visiting or where you're located. It's going to ask you the site, so I just put down the trail here, the town or municipality, which province you're from, whether or not this is your home residence. Next, you're going to say roughly what day of the week that you were out there collecting those ticks, and then where was it coming from? In this case, it was free from the environment. If it's off an animal, they're going to ask, is it a dog or a cat or another? We actually had what do we have this year? I think we had a moose and a goat submitted in the data, so it's really quite interesting. And then if it's off a human, it's going to ask the sex, and it's also going to ask an age class, because if you look at the data, disproportionately, kids between the ages of 0 and 10, and then kind of the elderly, are more prone to getting ticks. And that kind of makes sense. Kids like to wander on a path. If you ever had children, they like to pick up sticks and pine cones and all that kind of stuff. They're not going to be staying on the center of that nice cleared path if you're going to do it. Finally, you just got to hit submit, and it's up there, and then you're done for the day. If you really want to do some boosting of eTick, impress your house guests. I mean, I've got 14 submissions here. I don't want to brag. Most of those are vetted, and what that means is a technician from your province has gotten back to you, usually within 24 to 48 hours. So it's really quite a quick turnaround. We've had individuals from the public reach out to us saying, hey, I got this tick, I'm really kind of concerned. And the first thing we usually turn to is say, take some pictures, submit it, and then when you can, if it is off a human, go in and see your physician to get a better look at it, and we can get it submitted in for testing. But it's a great resource, and like I said, it's available across Canada. We really encourage you to take part and let people know that it's out there and it's super easy. But wait, there's more. So like I said, they'll let you know what kind of tick it is, and they're also going to ask, or they're going to let you know some relevant information and recommendations, and you get to go on this cool handy dandy map. If you do visit etick.ca, you can click on the map button and it'll bring up all of Canada, but you can actually dilute that, or zoom in on that based on province. You can look at species of tick, you can look at a time frame. So this is just a quick map of British Columbia. So each one of these little green dots is a submission that's taken place. You can click on that. It'll bring up the pictures that somebody submitted along with the species identification if it's there, or just to the genus. And then if you look at the blue just means there's between 1 and 9 submissions in an area, and they've clumped together. And as you work your way up, of course, orange is going to be 11 to 99, and anything over 100 or more is going to be in that red. So you can really see on Vancouver Island, especially around the Nanaimo area, there's a lot of tick being submitted. Same with the Okanagan and around the kind of Kelowna region. So help us help you. What eTick does is it really helps us figure out where the distribution, where the ticks are located, what species of ticks, because like I showed the map in the beginning, you get a lot of Ixodes pacificus on the southeast coast of British Columbia, whereas in the interior, you'll get more dermacenter ticks being submitted. Abundance, time of year, we really see a kind of a bimodal. So basically the shoulder seasons of summer, you'll see more ticks being active, kind of the nymphs in the March, April, May, June, and then in the fall, end of September, October, November, those would be ticks are most active, but in actual fact, ticks can, especially on Vancouver Island, be active year round. It's not unheard of to have ticks being submitted in December or January. So all this data really helps us in terms of response and better awareness, and also just getting messaging out to the public as to what's going on. And what's a tick talk without some tick prevention? And as I mentioned before, sticking to the center of trails, because you're not going to be brushing up against things where the ticks are actually hanging out. So the ticks, if I'm unfamiliar with ticks at all, they're going to be hanging out on foliage. They're going to be reaching up with the front pair of claws kind of in a questing position. I call it the toddler pick-me-up position. You get your 3-year-old going pick me up, and it's basically going to reach out and then grab onto you. So wear light-colored clothing, because it allows you to see those ticks if they are on you. When I'm out there dragging my 1 meter by 1 meter piece of diaper flannel from Fabricland, it is bright white, so that when I do look at it, I'm able to spot those ticks that much easier. So you're tucking your pants into your socks. If you're super hip, you tuck your shirt into your pants too, so that there's less chance of that skin contact right away, and you have a better chance of spotting those ticks. Where an insect repellent, something with DEET in it, is effective. And then when you're done and you're leaving those areas, just check yourself for ticks, and especially check those kids because they're the ones that are more likely, along with your dogs, to pick up those ticks. Take a bath or a shower to remove any of those loose ticks that are on you, and then toss your clothes in the dryer for 10 or 15 minutes on hot. And then safe removal of ticks. I've heard the gambit of all the different ways you can remove a tick. The recommended version, of course, is to take a pair of tweezers, go to the base of the skin, pinch gently, and then you're just going to slowly pull back on an even pressure there and to pop it out. And as I mentioned before, kind of seasonality is on the other sides of summer. And I think that's everything from me. If you have any questions, I think at this time, we'd love to help you out and answer those questions for you. And I'll just stop my share here.
Awesome. Thank you so much for your presentation today. At this point, if you do have any questions, please submit them using the Q&A feature. And I do think we have one that's already come through. Yes, one attendee asks, where can I find the infographic other than Twitter?
For sure, yeah, you can email me. I'll throw my email address in there, and I'd be happy to put that out to anyone who would like to. It's also available on our website, and I'll throw the website in the chat there too.
Perfect, yeah. Thank you. And I guess I have a question in line with that in the infographic. Exposure to ticks in the workplace is a problem for many professions that work outdoors. So in line, I guess, with your, I think it was the third goal of increasing information exchange, has there been any work done to connect with fields such as forestry or parks to share your findings or the infographics and connect them kind of with this knowledge and platforms like eTick?
Yeah, I can take a stab at that one. So, I think this first phase of the network and work that we're doing is really focusing on the evidence base and strengthening our ability to, develop habitat suitability maps and understanding and strengthening where our data, sources of data are coming from. So we're just now moving into more of that knowledge translation and trying to understand what those different needs are in terms of knowledge resources. So I think that's an audience, I think, of significant interest. We are looking forward to developing a second phase of the project that has a lot more interaction with communities at risk, vulnerable communities, and really understanding what their knowledge needs are. So I think there's been some preliminary connections with Parks Canada, for example, and different parks boards and groups to understand what kind of resources they may need. So I think these kinds of tools that we're starting to develop, I think, will be really relevant for those, and we can get those as targeted as possible to meet those needs.
Right. Yeah, absolutely. Let me see. Again, if you have any questions, please type them into the Q&A box there. I don't think there's any more coming in right now, so I will ask another one. I know you mentioned just kind of being in the first phase of this, and I guess maybe Dr. Cameron or Dr. Cork can answer this one, but is there any way you would like to kind of build upon or expand this work kind of going forward into the next stage?
Oh, thank you for the question. Yes, I mean, a lot of what we do is based on getting access to samples and data sets. And what we found is there's some really good work being done now with eTick and other programs to get more information about the ticks. But what is a bit sparse, other than for Lyme disease, is information on some of the other tick-borne diseases. So I think that's something that we'll work with a number of collaborators on in the future, in that there's probably things out there that we don't know about just because we don't have enough samples to actually assess it. And then the molecular aspect, I'll let Andrew talk about. As you get into any of these things, you realize that not all Borrelia are the same. And so when you're actually doing risk mapping, you've actually got to know a little bit more about the specific organisms that you're looking at.
Yes, and I will echo that point and I think that the genomics really can help us understand those differences and gives us so much additional data that we can start to examine temporally and geographically. From that genomic side, the whole genome sequencing, that's a fairly well-established technique at this point. One of the challenges has been, well, COVID, of course, compromising various lab functions and fewer bacterial isolates coming in the door. But what our primary goal right from the outset was to develop technologies that don't require the isolation of the bacterium, because that is infrequently does it work. So you may get many ticks that test positive for Borrelia burgdorferi, but the ability to actually culture the pathogen is from the minority of those samples. So then how do we sequence those genomes? And really that's where we're advancing on that front. And the proof of principle is looking very good that now, thanks to having so much genetic information, we can zero in on the genes of primary interest and develop these probe capture techniques to enrich those genes from a very, very complex sample. It could be any type of sample, really. And not only detect, well, presumably the pathogen's already been detected by classical PCR, but by sequencing the DNA, we get much more genomic insight. So that can help with genomic epidemiology. We can see the relationships by sort of classic sequence typing, or the vast amount of additional information we have there and looking more at virulence types and the genetic interactions and population structure that we're really getting into looking at now.
Awesome, thank you. We have a couple questions coming in here. First is, are there any KT approaches focusing on public health professionals?
Do you want me to tackle that one, Stefan? So sort of similar to my comments above, but also because this is a network and we've got very different sort of risk profiles and epidemiology of tick-borne diseases, ticks and tick-borne diseases in the 3 provinces, it really is a matter of supporting provincial agencies with the evidence that they need. So, for example, in BC, we have Ixodes pacificus as a primary tick of concern that may carry the agent of Lyme disease, but we've seen over 10 years that the positivity rate in ticks that are tested at our lab has not changed. It's been very low. And so that kind of information is what we share with our colleagues in health authorities and what we're trying to represent in some of the, for example, that tick submission infographic. So we really, our goal is really to support health professional and their supporting bodies to be able to message the information in a way that works for their audience and the context within their province and jurisdiction.
Perfect, thank you. Another question from an attendee. What is the accuracy of the digital picture ID? Are questionable samples validated? When Asian longhorn tick was identified in the US, they went back to archive samples and found the tick was actually found earlier, but not correctly identified.
Yeah, thanks so much for the question, Bob. Yeah, for identification purposes, what can happen is the technician, if they don't get a clear picture or if it's not at the correct location, they do have some specifics. They're really looking for the dorsal, the top side of the tick, and more the front, kind of the mouth parts, and where the scrotum is and stuff like that, because that gives you an identification as to genus, and you're looking for a couple other things, festoons and stuff like that, whether or not it's Ixodes or dermacenter. They can reach out to the submitter. So in certain cases, they'll reach back saying, hey, if you still have the tick, can you take a picture of this section, or could we get a clearer picture of a certain specific location to help with identification? They also do request ticks to be submitted in, and that's another part that I failed to mention is the BCCDC has partnered with ETIC in order to develop a couple of different programs where we are asking ETIC to get submitters to submit the ticks back to us in order to look at it and further either identify a tick. Dermacenter ticks, you can kind of get the genus Dermacenter, but after that, to find out if it's variabilis or ambuloma, stuff like not ambuloma, a different type of dermacenter tick, you do have to look under a scope. So they actually request those ticks to be submitted for further identification. So yeah, so there are validation steps that do take place. And if they are unsure, they'll pass it on or request those ticks to be submitted.
Awesome. Thank you, Stefan. With climate change affecting many parts of Canada, what tick and vector-borne illnesses can we predict in the next 10 years? Any leads from the data?
I guess I'll answer part of that there. Certainly, we know that Lyme disease is becoming much more of a concern in Eastern United States and Eastern Canada, and there's an awful lot of work being done on that right now. And there is also the concern about some of those Ixodes scapularis ticks being spread northwest through bird migration. Now that's a theory and there's some data to back it up, but whether or not we're going to get established populations in Manitoba, for instance, is again something that people are looking at quite carefully. Lyme disease, we've got early indications that there are potentially more positive ticks in the Pacific Northwest, but the data is just coming in now and we don't really know that we can make any assumptions based on just 1 year because the climate's been quite unusual recently. And then, of course, there's a heck of a lot of mosquito-borne diseases that there's a lot of concern about, both with human and animal populations. And then the Asian longhorn tick potentially can carry quite a wide range of pathogens. The thaliariosis outbreaks have been seen in West Virginia, for instance, in the US, and also in Australia and New Zealand, and that has quite an economic impact. But along with that, there's a number of different viruses that can affect people. And so I know a lot of our government colleagues are looking carefully at risk analyses around that, just to make sure that if it did arrive in Canada, we'd identify it really quickly and then be in a position to do some risk mitigation. Thanks for the question.
Thank you, Dr. Cork. We'll give a couple moments to those, if there's anyone typing, to ask couple last questions for our presenters. And if not, I believe that brings us to the end of our webinar today. Again, I want to thank our presenters for sharing their time and expertise with us today, and for everyone for joining us. I will put my email in the chat. If there are any questions for our presenters afterwards, feel free to email me and I will connect you with them. A quick reminder, please fill out the survey upon closing the webinar window on your device. We look forward to your feedback. There might be one more question coming in here. Yes, perfect. Any data of tick-borne diseases transferred from companion animals to humans?
I'll answer that, I suppose, in the general state. If your animals are bitten by ticks, if they get infected with a disease, it's unlikely to infect you unless you're bitten by ticks that are in the same area that have the same disease. But there's quite a lot of speculation. Some diseases aren't just tick-borne, they're transmitted in other ways, like Q fever, for instance. So there are diseases that aren't totally tick-borne that you might get from companion animals, but it isn't really a thing that we consider as a major issue. But on saying that, I mean, there's new diseases popping up all the time, aren't there? So we're always on the lookout and we always want people to be vigilant and report new things.
Sure. One more coming in. Can we expect to see the disappearance of some existing tick and or tick-borne diseases with global warming?
I'll try and answer that. Yes, well, some of the predictions on movement of vectors and vector-borne diseases do show areas where, when climate changes, they might be less likely to occur just because it gets more arid and dry. But this is all a bit speculative because there's so many different factors impact change, and it isn't just the climate, it's the human activity and vegetation. If you've got lots of forest fires, that has a different impact than maybe if you're going to have floods. And so I think what we're seeing is that it's really very complicated, but people are trying to look into that. And some of the maps show that there's areas perhaps in the prairies that might be less suitable in the future. But again, when you get changes in weather patterns, it can have unexpected impacts in different parts of the world. So we really don't know for sure.
Right. Yeah. Thank you so much for your question. And I believe there are no others. So again, I want to thank everyone and our presenters for sharing your presentation with us today. And thank you to everyone else for joining us. And have a wonderful day. Stay safe.
Wonderful. Thanks so much for
Thank
having us, Maddie.
you.
No
Thank
problem.
you.
Take care.
Bye-bye.
Bye.